Hi, I'm Sai Krupa Mareddy. Today's my final project is cardiovascular diseases and risk factor analysis. Coming to contents, it's introduction, problem, motivation, approach, results, and future work. Introduction. In today's world, cardiovascular disease is the leading cause of death. Cardiovascular disease prediction is critical challenge in the medical data processing. Accurate decision making and optimal treatment are required to address cardiac risk. Cardiovascular disease is difficult to recognize due to variety of risk factors such as high blood pressure, cholesterol, and abnormal pulse rate. The purpose of this data exploration and predictive analysis is to better understand which health factors affect a patient risk for heart disease. To accomplish this, an introduction to the data will be made along with graphical analysis of the health factors in the dataset. Problem. More risk factors gives a greater chance of developing cardiovascular disease. There are several risk factors such as overweight, physical inactivity, smoking, hypertension, and diabetes mellitus are associated with the development of cardiovascular diseases. The main purpose of this analysis is to understand which health factors affects a patient risk for heart disease. Motivation. Cardiovascular diseases have been the most common disease these days. Before it was mostly seen in age group of 50 to 75, but has in early days, it has become more common in early ages of life. We see people of age 25 are suffering from cardiac arrest these days. These may be due to food habits, tension, stress, cholesterol, blood pressure, and anxiety. This made me to choose this topic approach. The source of dataset is from the UCI machine learning repository. The dataset consists of data which describes the individual health factors and diagnosis of heart disease. The 12 health factors in the dataset used in this project. The Tableau platform is used for this project. Tableau is a valuable tool for data analysis and visualization. It makes it possible to create amazing interactive visualizations without using any code. Results. Coming to question one, which age group of individual is more susceptible to cardiovascular disease? From the graph, we can see that male of age group 30 to 39 and women of age group 70 to 79 are least affected to cardiac arrest. Both men and women of age group 50 to 59 are more susceptible to cardiac arrest. Here we can understand that in the age groups of 30 to 39, 70 to 79 are least affected, and 50 to 59 are highly susceptible to cardiovascular diseases. Coming to question 2, how much cholesterol raises the people's chance of developing heart disease? Cholesterol rate ranging from 240 449 is most commonly seen in both men and women for about count of 121 who has a chance of cardiac arrest. The range from 500 600 have least chance of cardiac arrest. Cholesterol in the blood leads to buildup on the walls of arteries, which leads to heart attack. Here we can see that the range of 240 and 449 are in both men and women are highly susceptible to cardiac arrest. How chest pain in men and women varies. Women of age group 34 are least susceptible to chest pain, where the rate is 2, and a maximum is seen in age group of 35 to 74, where the rate is 4. The men of age 36 are least susceptible to chest pain, where the rate is 3, and maximum is seen in age 70 to 75, where the rate is 4. Which age group of men and women are suffering from cardiac arrest who had blood pressure? People of age 30 to 76 are least affected by cardiac arrest who had blood pressure of 120 mmHg and 125 mmHg. People of age 53 are more susceptible to cardiac arrest with rate of 200 mmHg. Future work. Primary or secondary cardiovascular disease therapy is less common among poor individuals and communities. These inconsistencies may be reduced by putting systems of care for these people in places. There is huge opportunity to improve the health of the poor people by communicating and placing into practices effective prevention measures. For example, a reduction in daily salt intake of 3 grams is expected to result in a 15% drop in coronary heart diseases in men and women as opposed to a 10% drop. Similar decreases would be expected for both overall mortality and stroke. Thank you.